Hi, I'm Dr. Matt Penn. I'm a GP at the North Richmond Community Health Service, and I think today we're talking a little bit about PrEP. So PrEP stands for pre-exposure prophylaxis, and the idea behind PrEP is to take a single tablet a day consisting of 2 drugs we use to treat HIV to prevent HIV, with the goal of reducing the number of new cases of HIV that we will see in Australia each year. HIV stands for human immunodeficiency virus, and it is an infection that specifically targets certain parts of the human immune system and stops those parts of the immune system from working. So if someone is infected with HIV and they're not on treatment, with the passage of time their immune system will become less capable of fighting off infections, and the person can progress to what we call the acquired immune deficiency syndrome, also known as AIDS. PrEP is currently funded for people who are at moderate to high risk of acquiring HIV, either through sexual exposure or through other ways of acquiring HIV, such as sharing contaminated injection equipment. So PrEP is currently funded by the PBS, and the current cost is about $38 per month. Someone on a healthcare card will get that for $5.80. People without Medicare access can actually self-import PrEP with the aid of a general practitioner's prescription. That cost is usually about $60 to $90 for 3 months worth of PrEP. Most people tolerate PrEP extremely well. About 70% of people report no side effects from taking their daily medication. For the 30% of people who do report side effects, most of the side effects are very mild and they tend to disappear within 2 to 4 weeks of commencing the PrEP. And typical side effects include feeling tired, mild gastrointestinal disturbance, which could be a bit of nausea or loose stools, and some people report mild headaches. Generally, those side effects will disappear quite quickly. As doctors, though, there are a few side effects that we worry about that the person wouldn't necessarily feel, and in particular, PrEP can cause problems with the kidneys. So as part of working someone up for PrEP, we would do a baseline kidney function test, and every 3 months we would recommend that that person comes back and sees the doctor prescribing their PrEP for a checkup of their kidney function test. Problems with the kidneys on PrEP are rare, but it's an important thing that we should not miss. PrEP is able to be prescribed by any doctor in Victoria. There are some doctors who know more about PrEP than others, and there are website guides that give the addresses and locations of doctors who are very much involved in prescribing PrEP. But any doctor is legally allowed to prescribe it. So once the person has a prescription for PrEP, you can actually take it to any pharmacy in Australia. Most pharmacies in urban areas would probably have it in stock, but those that don't could probably order it in within 24 to 48 hours. It's actually becoming increasingly popular, and most of my patients report no problems with accessing PrEP through city pharmacies. So PEP stands for post-exposure prophylaxis, and PrEP stands for pre-exposure prophylaxis. And it's quite easy to get the two confused. The way to think about it is PEP, or post-exposure prophylaxis, is started in reaction to a potential exposure to HIV. So for example, if someone has unprotected sex with a casual partner and they're worried that they may have acquired or been exposed to HIV from that exposure, they can present to a post-exposure prophylaxis after the event has occurred, and they can be assessed for whether they start post-exposure prophylaxis, which then involves taking quite often the same medications for a period of 28 days after the event has occurred. Pre-exposure prophylaxis is different in the sense that we're anticipating future potential exposures to HIV that have not yet occurred. So the person starts taking the PrEP before future events have actually happened. If someone is interested in going on PrEP, I would recommend that they go and talk to their GP or a sexual health nurse or another doctor who is interested in PrEP to talk about their actual risk of exposure to HIV, and if their risk is considered to be a moderate or a high risk, to then seriously think about going on PrEP. And that would involve having a number of tests done, including a baseline sexual health screen and a kidney function test and a baseline HIV test. People can find more information about PrEP at www.ceh.org.au/PrEP.